Good afternoon, everyone. This is Sarah Barker, founder of Connect Our Elders. And today I have the pleasure of speaking with Tina Buchanan, the CEO and founder of Visionary Care Consultants, and Capri Tenorio, who is the Thoughtful Engagement Program facilitator. So many of you that are watching, you've seen me talk to Tina before. I really love her why behind why she started Visionary Care Consultants, but I want her to share it with you herself. So Tina, thank you for being here. If you don't mind, please share with the audience why you're in this line of work, why you're a care manager, and why you started Visionary Care Consultants.
Sure. Hi, Sarah. Hi, Capri. Thank you, everyone in the audience, for joining. It's been a while since I've been on here. So I started Visionary Care back in 2017. I had been a home health and skilled nursing facility social worker for the past 10 years. And I realized there was gaps in services and that people really needed advocates that could hold their hand and really make a difference and walk them through the phases of aging in place and dealing with all of these challenging resources. And so in 2020, during the pandemic, I had always known that I wanted to touch on isolation and depression more than what we've been able to as care managers within Visionary Care. And I reached out to a colleague of mine who had a program called Thoughtful Engagement that really helped to reduce isolation. And I said, I want all in. I want this to be Visionary Care's next step in the process of serving people. And so that's how it all started. And so now we have our Thoughtful Engagement program, which is our next endeavor to help seniors and really adults of all ages.
Thank you. Before we go deeper into thoughtful engagement and hear Capri's story, please share what sets Visionary Care apart. One, the fact that they have the thoughtful engagement program, but what are some of the other differentiators?
So Visionary Care is really unique in that we have several different types of clinicians. So we're really able to focus on anything from not only aging care, but dementia, medical type cases, but also mental health care management. So we have quite a bit of clients who are in the mental health care population, and they really need someone to walk them through the process as well. So that really sets us apart. I think the other thing that's unique about us is we really work as a team. So with Visionary Care, you not only get Tina or Capri, you will get the whole team if that's what you need for your loved one, because we all bring something to the table that's unique for the clients that we serve.
Wonderful. So before I circle back to you, Tina, to explain a bit more about what the Thoughtful Engagement Program is, let's talk to Capri for a second. So Capri, thank you for being here.
Hello. Thank you for having me.
You're welcome. Why are you in the elder care industry? What has compelled you to want to work with this population?
Well, I've been in the elder healthcare field for about 11 years. I started off as a caregiver. I did CNA, and I got into activities. I was an activities assistant for a while. And through being in the healthcare for so long, I noticed that there was a need for special engagement, more personal one-on-one, because a lot of the times the mental health, psychosocial slips between the cracks, and it gets lost in the sauce of everything that's going on. And these people are becoming depressed, isolated. And for them to have that engagement, that one-on-one, that not only, will meet their needs mentally and psychosocially, but emotionally, spiritually. And it's a better quality of life all around. That's what I believe.
And your personal experience, so I know this, but I think that that the audience should hear this. So you had a personal experience with how actually engaging someone in activities, right, can improve their quality of life. So would you mind sharing your personal story with your loved one?
Yes. In 2020, my father was, he was passing away. And he passed away April 4th of 2020 of colon cancer. And in the midst of everything, he was battling his depression, his isolation. He was lost. He was angry. He was confused. He was just emotionally distraught. I came into his life in March, because he was a very strong man. And I started, because he had been in the hospital and he had been telling me, I want to come back home. I want to come back home. And I was determined to bring him back home and give him that quality of life for however long he had, which was a month and 4 days. So I brought him home and I engaged like no other. He told me that he had a better sense of mind, better sense of feeling and support being at home, engaging in these activities. There was a point where he was so engaged that he told me, I think everything's going to be okay now. Everything's going to be okay now.
So that's wonderful.
And,
so you were doing this. You were doing this higher level of engagement with your own loved one before you even knew that there was a program called Thoughtful Engagement through Visionary Care that you could go and make part of your career path, right? So you have this personal experience with it. You can actually speak to the effectiveness of how doing a higher level of engagement improves the quality of life, right? And the relationship. So
it was very great on the relationship, and it drives me from that experience. It drives me to create the best quality of life for these adults and seniors suffering from their cognitive illnesses.
Well, thank you. That's great. It's great that you have that, you can identify with it on a personal level, right? Because you're going to be carrying it out with that same level of passion. So let's learn more about exactly what the Thoughtful Engagement Program is and how it's different from other engagement programs. So Tina, why don't you start with explaining what is this program and how is it different?
Thank you so much for sharing your story, Capri. It really shows that when you have a personal experience with this and you make it a profession, that you can really make a difference because you know the value of it personally, and it's so close to you with your dad. So thank you for sharing that with everyone. I really appreciate you opening up to Sarah's audience about that. So let me tell you a little bit about thoughtful engagement and what the program really means. It's just like it sounds. It's so simple, but it's really a whole nother level. It's thoughtful, engaging, one-on-one, meaningful programming. I won't even say activities because to me and to the clients, it's different than activities. It's not playing bingo. It could be if that's what the person enjoys, but we get really deep with our clients during the assessment process in getting to know what makes them tick, what makes them who they used to be when they were in their prime. So we take them back to who they were at their being when they were in their prime, whatever age that was in their life. So that's really what the program means, is thoughtful, engaging, meaningful, one-on-one, soul-driven programming. And that's really what it's all about.
And I think what is very unique is that it's not it's not like there's just this list of activities and it's going to be the same activities for every person, right? So this is a customized thoughtful engagement program to the actual individual, right? So what did they like doing before? And let's do those things. So you're not trying to force the activities that somebody else likes onto this other person, right? It's all about what do they want, right? What is the family telling you guys that they used to enjoy, right?
Yes.
Exactly.
Okay. So who is this program for? So people listening in the audience, they're thinking, well, yeah, this program sounds awesome, but I don't know if my loved one is the right fit for this program because they're already so cognitively declined. Or, oh, there's no way that my loved one is going to be open to somebody coming in and that they don't know playing cards with them, let's say. So can we define for the audience who this program is for and kind of dispel some of the preconceptions or misconceptions that they may be having?
Definitely. Capri, why don't you talk about who this program is for?
Well, this program is for adults and seniors of all types, basically who are suffering from isolation, depression, anxiety. Maybe they have schizophrenia. Maybe they're bipolar. Any cognitive illness that they're suffering from. I'm able to meet them where they're at, in wherever they're at cognitively. I'm able to meet them there. So maybe one thing isn't working with someone, with a caregiver, or they're just not able to get through. I'm specialized to dig deep inside and bring out those qualities that they had once before, that excitement, that purpose, that just looking forward to the day, to what the day is going to bring next. Mm-hmm. Mm-hmm. And I design it solely based on their preferences, their strengths, their needs. I can position myself from bedridden to wheelchair bound to up and alert times 4. I go from museums to, yes, if they just want to sit down and play cards, that's fine. And I build this relationship with them. I build this trust with them. And so I'm not just that person coming in to do activities with them. No, I'm their friend. I am their support. I'm their advocacy.
Wonderful. Thank you. So how can a family member or an advisor, right? So the referral partners in the community, our legal financial counterparts, or maybe a social worker or a resident services director, how can they identify when someone could benefit from this program?
Well, I mean, if they see signs of depression, if they see signs that the family is getting, they don't know what else to do. They don't know. They've tried, engaging themselves. They've tried to have the caregivers come and engage with them, but they haven't found what they're looking for. And what they're looking for, a lot of the times, is the stimulation for that client, and it gives a sense of relief for the family that their loved one is getting their social psych needs met by engagement, that they're seeing a difference in appetite if it was low. They're seeing a difference in their sleep pattern. It's gotten better. It works. I believe when the soul is well and the mind is well, the body will follow, and they're able to. They're able to. They're more likely to comply with the caregivers in their assistance. So it's all about bringing that spirit and that support out. And in a way, it's a support system for everyone, just knowing that their loved one is being taken care of. The social worker has met the family's needs and their client's needs. And most importantly, the client feels as though their needs are being met.
And they're valued and seen.
And they're very
happy.
valued, and they can see, yes.
So how is this different than caregiving? And I want to preface that by saying, now listen, right? I have a home care background. Just about every home care company is going to say, well, we provide engagement through our caregivers. And what I have noticed is that it really comes down to the individual caregiver and maybe how proactive they are, or just their own personality, right? And the things that how they engage personally. So how is this different than caregiving?
Well, it's different from caregiving. I've been a caregiver. I CNA, and I've been on the floor. I've dealt with many situations, and it is very. You have to teeter-top when you're in when you're a caregiver and trying to give that good mental quality of life as well. So all ADLs are met with the caregiver, and that's their focus. It's not fully focused on the mental, psychosocial part of the individual. So what I specifically focus on that. I take the whole time just for that purpose of their mental status. Are they socializing well? How are they feeling? So I'm able to focus that because being a caregiver before, I don't have a laundry list of things that need to be done. I don't have that how do you say that checklist that I have to get the dishes done. I have to make sure their clothes are dry. I can focus on them and them alone.
Right.
And
so I want to clarify for the audience, right? So the thoughtful engagement program and what Capri is doing is not caregiving, right? This is specifically a thoughtful engagement program, but that doesn't mean, so here's the thing, your loved one can have this program and have the benefits of the program without having caregiving. Or if you do have caregiving in the home or wherever your loved one is, whether it's boarding care, assisted living community, right? They can still have the caregiving, but you can also have the thoughtful engagement program. And the reason why this is beneficial is because your caregiving service is ensuring that your loved one is warm, rested, fed, like housekeeping's done, all of that stuff, safety, right? And then supplement with the thoughtful engagement program to really add to their quality of life. The other benefit, and so all you families, right, that have caregiving, or if there's some home care agencies listening right now, the other benefit is that when Capri is going through the thoughtful engagement program, engaging the client, is that the caregiver that you have can observe and learn the activities. And so even when she's not there doing it, that caregiver can still learn to engage your loved one at that same level. So it is a win-win for everybody.
Yes. And that's the beauty of this program is that, I'm able to help from those aspects, not only the caregivers learning the engagements that I do, but also them being able to maybe kind of at times when I'm not there to perform it themselves and engage as well.
I feel like at the end of the day, there's the benefits for the client, right? And I want to talk about the results of the program, but in general, what it does is it elevates the plan of care automatically, right? Because the client's getting the extra attention, but also the caregiver is getting this extra training that the caregiving agency or the family is not having to pay for, right? So it's elevating everybody involved. Okay, so what are the results of the program?
The results of the program would be a change in behavior. If it was conflicting before, it won't be. It'll be easier for them to. It'll be easier for them to comply, and it because they've been engaged all day.
Mhm.
They have a better sense of what's going on, and so they can. Their behavior will change. Their sleep patterns will change for the good.
Mhm.
It'll also sometimes if everything that I'm doing, I can even say, hey, you know what, maybe things this person needs to be looked at in a deeper sense. Maybe they're having some kind of medical problem, UTI, because that can also make things difficult with that when they're sick. But yeah, it'll increase appetite, fluid intake, and just the whole quality of life. Like you said, Sarah, it just raises that bar to where it's very very good for them. Very good quality of life. And that's what we like to see. We like to see our elderly community and people with mental illnesses find a program that they can thrive from, that they can grow, and even just have that support. So yes,
Absolutely.
I feel it's very, very important. Very important.
Mm-hmm. So where do people go to learn more about thoughtful engagement? And I will say, I say it in just about every one of these interviews that I do, it does not hurt to get educated on a resource. Just because you reach out to get more information does not mean that you're contracting into anything or that you're going to be, pressured to sign up. But big believer of being proactive and getting educated and understanding your resources, so that way when the time comes for your loved one or your client, you know what's out there, right? And you know the resource already. So I encourage you, they're going to tell you where you can go to learn more information, and I encourage you to go do that. Just go read about it, get more information, call them if you have questions. So Tina, where can people go to learn more about the Thoughtful Engagement Program?
Thank you, Sarah. And thank you, Capri, for explaining that so nicely about how this program really has results. The one thing I do want to add is that you will also notice that your families that you're working with, if you're a referral partner or a community referral, that you'll notice the family is a lot more at peace because they know they're giving their loved one that extra, not only support, but joy. And one of the words that Capri mentioned, I just want to point out, is purpose, right? So at the end of our lives, to find that purpose again, even if it's in the last days on hospice, or even if we're going through something really challenging, and you enjoy this program and have that engagement, we've seen so many clients say to us, wow, I didn't realize that I could do X, Y, and Z. And because of this program, I can now do X, Y, and Z. Or I can now feel, right? If they can't do something because they have a physical limitation, I feel like I don't have a disability anymore. And that is what it's all about. So I just want to point that out, because that sense of purpose and joy is really what they get from this. And the families will feel it. The community will feel it. Our engagement specialists like Capri and all the care managers and the referral partners, you will notice a difference in their quality of life and their being. So I just wanted to add that. So thank you, Capri, for pointing out that word purpose, because to me, that's what this program is all about.
Yes,
I love
I
that.
agree.
I love that.
Where to find us? Is that the question, Sarah?
Yes. How can they reach out to learn more about thoughtful engagement?
So definitely reach out to us. You can find us on our website at www.visionarycaresd, like San Diego.com. You can also find us on Facebook, LinkedIn at Visionary Care. And our local telephone number in San Diego is 619-228-3584. We're available. We have someone answering the phones 24/7. Just let them know that you're interested in the thoughtful engagement program, and we will do a free consult with you. It lasts about 30 minutes, and we can really do a deep dive and figure out if this is the best program for your loved one or the referral that you're reaching out about.
Wonderful. Well, thank you so much, ladies, for being my guests today.
Thank you.
You're welcome.
Thank
As
you.
a reminder, the entire intention of Connect Our Elders is to empower the aging process, or empower aging. And we do that through providing education around the elder care resources that exist, navigation through those resources so you can make the right choice for your family, and ongoing advocacy. And we do this by presenting partners like this who have these programs to add quality of life and a sense of purpose to your loved ones. So thank you for joining us today. Enjoy the rest of your day.